Okay, let's get back to our breaking news on the story that has a lot of Canadians paying attention right now. The federal government has reached an agreement in principle with Ontario and all the Atlantic provinces on health care, and more provinces are expected to sign on as well. Later this afternoon at about 4 p.m. Eastern, the federal ministers of health and intergovernmental affairs are going to hold a press conference. So we'll be sure to get more information at that time and carry that for you live. But in the meantime, let's turn to CBC's Marina von Stackelberg. She's joining us live from Ottawa with the latest. So Marina, first it was Ontario, then slowly but surely, one Atlantic province after the next says, okay, we're down for the deal. What do you know?
Yeah, so we saw this morning Ontario be the first province to come out and say, in principle, we have signed a bilateral deal with the federal government. Now, but back on this, the fact is that the premiers of all the provinces and territories met with the Prime Minister earlier this month to say they needed more healthcare funding. And now we, quite one after another, have heard from different leaders of different provinces saying they do have a deal that they are ready to sign with the federal government. Justin Trudeau kind of broke some of the news just a few minutes ago. Let's have a listen to what he had to say out in Atlanta, Canada.
Good news this morning, which I wasn't supposed to announce till later at a press conference, but I'll give you guys a little preview. We've actually just confirmed agreements in principle with the 4 Atlantic provinces and Ontario, who've said, yes, we're in for these healthcare deals. Let's start negotiating the details on how many family doctors we want to add, what we're going to be investing in mental health, how we're going to move forward to get the best possible outcomes for Canadians over the coming years. So that's fresh off the press this morning that a whole bunch of provinces are raring to go. There's lots more to do.
So, the provinces and territories are responsible for administering healthcare in their own jurisdictions, but the federal government helps to pay for it. And so the premiers for months, some will say for years, have been going to Ottawa saying, we need more money to pay for our healthcare systems. We cannot handle the strain that we are under. And that pressure kind of mounted until this meeting happened when the federal government presented the provinces and territories with potential deals for more funding. Now it was up to the provinces and territories to negotiate these bilateral deals, these specific deals with each province and territory for money for their specific healthcare concerns. And so Ontario came out today saying they expect to get $8 billion of $25 billion that was set aside for these bilateral deals to help with their healthcare situation. Now, Ottawa also gave $2 billion for immediate needs, basically saying this will be an immediate influx of money to help you deal with your major healthcare issues right now. And so Ontario is going to be getting about $776 million of that. I want to read a statement from the health minister, the federal health minister, Duclos. He said, today's agreement in principle with Ontario is an opportunity to continue our collaboration and improve the experience of health workers and those they care for. It will modernize our healthcare system. He goes on to say, oh, sorry, that's the end of the statement. Oh, no, I'm wrong. He continues to say, that this will improve access to family health services and mental health services, reduce surgical backlogs, and support healthcare workers. Better quality of care means helping Canadians live longer, healthier lives. And that's a pickup on what a lot of this debate between the provinces and territories was, which was essentially Ottawa said, we'll give you more money, but you need to tie it to specific strings. You need to meet specific goals that we've decided are priorities for the healthcare system. And the minister touched on some of those there, including, improving access to doctors, fixing wait times in hospitals and for procedures and surgeries, working on improving mental health services, and also modernizing the healthcare system, which was a big point for the federal government, which was essentially, we're not sharing healthcare data properly enough within our own jurisdictions and across the country. And so it appears that Ontario and the Atlantic provinces have agreed, have presented proposals for these bilateral agreements. And now we're going to see and wait to see if the other provinces and territories also announce agreements with Ottawa today or in the coming days as well.
Okay, CBC's Marina von Stackelberg in Ottawa. Thank you.
Take care.